Today we're covering the topic of concussions. Here with us, Dr. Lionel Herrera with Tri-Valley Pediatrics board-certified pediatrician. So why has there been so much buzz about concussions lately?
There's been a lot of press, a lot of media about concussions because a lot of high-profile cases of athletes that have suffered severe brain damage. There have been wrestlers that have suffered severe depression and have suspected to have been suicidal because of their concussions. There's also a new law that's passed in California, AB 25, that is now requiring schools to pull athletes out if they've been suspected of having a head injury until a health professional can evaluate them, which I think is a good step. It's protecting the athletes, but it's caused a lot of questions and concerns among the athletes and parents.
So what is a concussion?
A concussion is a head injury that occurs whenever there's a jolt or a sudden impact to the brain. And when that happens, the brain basically bounces around inside the skull. And the skull is basically a solid object. And so when the brain hits the side of the skull, it causes injury to the brain cells. And athletes that experience a concussion might feel dazed and confused. They may have difficulty remembering after having a concussion for that reason.
What are the symptoms of a concussion?
Symptoms of a concussion can vary quite a bit. Some athletes will only experience mild symptoms like being dazed, whereas other athletes might experience severe symptoms such as vomiting or severe headaches, so it can vary quite a bit.
What should be done if an athlete is suspected of having a concussion?
The most important thing is, when in doubt, sit them out. And the reason that's important is we don't want our coaches or our trainers trying to guess as to whether or not the student athlete has had a concussion. Rather, let the professionals do it. So all they need to do is make sure that they don't return to play, and then they'll see a doctor potentially the next day, or if it's been a severe injury, then they can see a doctor immediately. The reason that's important is it protects the athlete, it protects the team and their family from an athlete going back to play before it's time, before they're ready, and suffering a severe, potentially life-threatening injury.
Why is it so important for athletes suspected of having a concussion to not return to play before they have fully recovered?
I like to take the analogy of an athlete that suffered a knee injury. After a knee injury, of course your knee swells up and they're limping, so it's very obvious they've had the injury, but no one would think about returning them back to play. But after a concussion, the symptoms aren't so obvious, but they've suffered an injury just the same, and if they go back to play before they fully recover, then they're more likely to suffer a syndrome called second impact syndrome, which is what occurs when you've had a head injury and then you go back to play. You're more likely to have a head bleed that can be life-threatening, that can cause permanent brain damage, and that's what we're trying to ultimately prevent.
How do you treat patients in your practice that have suffered a concussion?
Well, first we focus on prevention and education, so we talk to the athletes about making sure they're using proper headgear, about making sure they're using proper technique, and we also do baseline testing. And baseline testing basically allows us to test their memory and concentration skills, their balance skills, before they have a head injury, so that when they do experience a concussion, we can make certain that they're back to their baseline before they return to play.
So going into the summer, what do you advise all the athletes out there?
Well, the important thing is to have fun, and most of all, be safe. It doesn't do you any good or that team any good to play when you're injured. And you can turn a mild injury into a season-ending injury, which is going to really affect your team if all of a sudden you go from missing one game to missing the whole season.
And this concludes our topic on concussions. Thank you, Dr. Lionel Herrera, for the valuable information.